Hello, thank you for joining us at Coeur Pediatrics video educational program. I'm Dr. Terence Neff, and I'll be presenting this portion of the program. Today, we are going to be talking about newborn issues, primarily hiccups in newborns. You have to remember that this video education is not meant to diagnose or make specific treatment recommendations for your child. It is informational only. If you do have questions concerning your child that are very specific to your child, then I would recommend that you make an appointment with your primary health provider to discuss these issues. We at Coeur Pediatrics are accepting new patients, and I'll talk about how to make an appointment with our office if you so desire later on in the video. Right now, let's talk about hiccups. And hiccups in little children, especially newborns, are extremely common. That's one of the most common questions that parents ask me about when they come in during the first few weeks. Oh my goodness, my child's hiccuping. Is there something wrong? Is there a problem with their foods, or what exactly is going on? I want to spend a little bit of time with you talking about the mechanics of hiccuping and exactly why your child will hiccup. Hiccuping occurs when the diaphragm, or the main muscle at the bottom of your lungs here, goes into spasms, and that causes the hiccuping. Little children hiccup, and infants hiccup, because the diaphragm is irritated. You say, well, what could irritate the diaphragm? You have to realize that when they're born, little children have stomachs about the size of a walnut, and then it stretches as you get used to eating, and food stretches it out to get the size that we have as we get to be adults. But little children, especially infants, have never had their walnut, so to speak, stretched out. And when that happens, it pushes against the diaphragm. Well, the diaphragm has never had this type of stimulation before, and so when it gets stimulated, then what it does, it goes into spasms and children hiccup. And so you notice with your child that your child will hiccup almost always after meals. Not before meals, but almost always after meals. And this is a sign that the stomach has been distended and is pushing against the diaphragm. Once the children get used to having a full stomach, the hiccuping will decrease quite a bit. However, adults can hiccup, and usually when we hiccup, it's after a full meal, maybe drinking champagne. It's not the champagne or alcohol that makes you hiccup, it's the bubbles that causes stretching within the stomach that pushes against the diaphragm that cause the hiccups to occur. So even though hiccups can occur as adults, they're extremely common in little children, especially infants. When a mom comes in and tells me the child hiccups a lot, I tell her, congratulations. Number one, it meant that your child ate well, and number two, it means your child probably doesn't need to burp, because 1 or 2 or 3 hiccups will get all the burps out. Hopefully, this discussion has addressed some of your concerns about the hiccuping that your child has. As I mentioned before, our office is available to talk to families and to visit with families on same-day and next-day appointments that are available on a regular basis. We take almost all insurance, including TRICARE and Medicaid. You can visit us on our website at www.cdapeds.com or call our office at area code 208-667-0585 to set up an appointment. Thank you for viewing this video.